As we see more non-COVID viral illnesses in the community, we're also dealing with a drug shortage at pharmacies, a topic we've been discussing for a while. We're joined now by Justin Bates, the CEO of the Ontario Pharmacists Association. Justin, as always, thank you for joining us.
My pleasure.
Justin, right now on the Canadian government's website, it says once again that there's a shortage of infant and children's acetaminophen and ibuprofen all across the country. They say there's been unprecedented demand for these products, and while supply has increased, we continue to experience shortages. Health Canada is working with suppliers to get these drugs. So what are you hearing? I mean, that's the Health Canada message. What's the status you're hearing?
Well, the good news is we are starting to see some replenishment of children's Tylenol and Advil, and that's certainly welcome, given the shortage that we've experienced since September and August of this year because of a 300% spike in demand, which is outside of the typical consumption patterns, likely due to more people unmasking, the lifting of public health restrictions, so people are getting fevers, as well as uptake in surgeries as we start to look at the backlog and needing pain medication. So that doesn't mean that we're out of the woods yet. We still have a shortage, and the manufacturers have increased their capacity on the production lines by 34%, which is a record high. In order to be where we want to be, probably we're looking at December, January when it comes to the children's Tylenol and that.
And that's concerning, December, January, because as all the healthcare professionals we speak to say, we are in for a challenging winter. In saying that, I want to ask you something here, Justin. Again, on Health Canada's website, it says if you're having trouble getting this medication, as many people are, to speak to a healthcare provider or a pharmacist like yourself. It says your pharmacist can help you choose the right product based on availability. What could some of those alternative products be?
Well, when we look at the pain and fever relief medications, they are essentially a single ingredient of ibuprofen or acetaminophen. And in the cases where there's an adult version available, parents can ask the pharmacist about dosing based on the age and weight of the child to split those tablets and either crush them and put them into foods to help with digestion, like applesauce, or we have techniques to treat or teach kids, rather, to swallow pills. And those were the main options, as well as compounding. So some pharmacies have the raw materials of acetaminophen and ibuprofen and are making up compounds. So I would encourage all parents to talk to the pharmacist, see what options exist, and also understand that not all fevers need to be treated with medication. There are home remedies that are available, rest and fluids, and various other techniques that, majority of these fevers will subside over a 48-hour to 72-hour period, and to consider those options as well.
We've been talking about this strain of viruses, non-COVID-19 related, impacting children. The story we shared just before you joined us on screen is wait times of up to 12 hours at Sick Kids Hospital because they're dealing with more patients. Are you seeing more parents come in saying, can you help me with this? And of course, the healthcare system is already overburdened. If it's an emergency, people should go to the emergency room, but they do have the option of seeing a pharmacist to get some guidance.
Absolutely, and we would encourage that. Speak to your physician, your pharmacist. We want to avoid people going to emergency departments wherever possible, because we have to create capacity in the healthcare system, expecting a worse than what we had last year, flu season and respiratory illness season. One of the things that we're looking at is how can we mitigate further shortages by avoiding things like hoarding or panic buying, and that's also what contributed to that 300% increase in the late summer, early fall. And once it gets replenished, we're recommending that pharmacists put it behind the counter and limit it to one box or one bottle for the liquid formulation per customer, and that will help make sure that those who need it get it until we're at a place where we have more supply on the shelves over the counter.
Jason, thank you. Last 20 seconds here about flu season. I mean, there's been consistent encouragement to get the bivalent COVID-19 booster, but in the midst of the pandemic, I think many people kind of put the flu shot aside. You want to share anything on that?
Absolutely. We have over 4,000 pharmacies participating. It's open to the general population starting November 1st. We're dealing with seniors now and those that have high-risk conditions. It's very important to get the flu shot. We can co-administer that with the COVID flu if you're getting your booster. But I would encourage everybody to get protected and go to their pharmacy to do so.
Okay, Justin Bates with the Ontario Pharmacists Association. Good advice as always. We appreciate it. Have a good day.
Thank you.
Thank you,
Take care.
Justin.